Opening operation of post-injection abscess of buttock. Interesting about science and medicine, prepared by editors of a page all scientific. A post-injection abscess of a buttock is a localized accumulation of pus in this area of the body. The content of the abscess are liquid pus that occur as a result of necrosis of the body tissue. This disorder is a complication that occurs as a result of careless injection into the buttock. Most often, the causative agent of this type of abscess is staphylococcus. Materials and instruments for operation of opening a post-injection abscess of a buttock: syringe, anesthesia needles, procaine solution, scalpel, Cooper scissors, steel clamps, needle holder, cutting ground needle, several threads, sterile gloves, hydrogen peroxide, antiseptic solution, alcohol, iodinate, dressing material, sterile lining. Before the operation, 30 minutes pre-medication is mandatory. The patient is placed on the healthy side. The perineal and genital are protected from the flow of pus with a linen or towel. The surgical failed is treated with iodinate before performing anesthesia. It is necessary to mark the line of a proposed incision with a cotton brush moistened with brilliant green. Using an intradermal needle away from the hyperemia zone, they begin to inject a solution of procaine to form a lemon peel. Then take a longer needle and inject an anesthetic solution into subcutaneous tissue and under the infiltrate. Usually, procaine solution is used. Attention, the main mistake when performing anesthesia is anesthesia of only the skin without injecting no procaine under the infiltrate and on its sides. Using a scalpel, open the abscess for at least 5 cm. Then, having removed the pus, revise the cavity of the abscess with the index finger. Bluntly but without effort, separating the breach and opening the existing pockets. Then, expand the incision in one direction or another so that there are no pockets. Attention, it is necessary to remember that the wider the abscess is opening, the sooner the recovery will occur. The post-injection abscess should be opening so that the incision extends slightly beyond the infiltrate. Sometimes one incision is not enough to fully drain the abscess cavity. When an additional incision is made over the pocket furthest from the main incision, a counter opening is made. After opening the abscess, pus and detritus, the stringed tissue are removed with a finger and napkins soaked in a solution of hydrogen peroxide. The existing bleeding, which in most cases is insignificant, is stopped. The novus bleeding is stopped by pressing with a gauze ball or tight tamponade of the abscess cavity. Tampons are inserted vertically into the wound. Sometimes arterial bleeding may occur from the skin or subcutaneous tissue. It is stopped by suturing with catgut. Tampons are usually inserted with a hypertonic solution or dry. An antiseptic bandage is applied. The patient must be observed by a physician after the abscess opening operation. This is necessary because bleeding from the wound may instantly occur in the first 12 hours after the operation, which can occasionally be quite profuse. If bleeding occurs, the wound must be revised. To do this, the patient is given intravenous premedication, solution of promethazine or baralgin, solution of diphenhydramine, and atropine sulfate. The drugs are diluted in isotonic sodium chloride solution and slowly administered intravenously. After 2-3 minutes, the wound revision can begin. What materials and instruments are required for wound revision? Plate hooks, hemostatic lamps, needle holder, cutting needle, suture materials. During revision, carefully remove the tampon from the wound. The first to be removed are those that are the least soaked with blood. After removing all the tampons, carefully examine the wound using plate hooks. Having identified the bleeding site, it is stopped by applying a clamp and suturing the bleeding vessel with cotton. The revision is completed with a new tamponade. The first dressing after opening a post-injection abscess of a buttock is done on the first day after surgery. In this case, only the upper layer of a dressing soaked with blood is usually changed. On the second day, the preliminary medication intramuscular with tampon are changed with repeated sanitation of a wound with hydrogen peroxide solution. During the dressing, proteolytic enzyme with antibiotics can be introduced into the wound. Future treatment is normal. Thank you for your attention. This material is prepared by editor to the page of Scientific. Attention, this material is for informational purposes only. When observing very unusual symptoms, it is recommended to consult a doctor. Subscribe to our channel. Thank you. Bye bye.